I'm just trying to process what just happened.
Welcome back. We are bringing you in with Process by Her as we continue our series Enough. Just Heal Bro. 3 words with so much meaning and the life's work of one man creating space for Black men to discuss their mental health. Now, before we get into this conversation, I have to let you know we are going to be tackling some very tough topics. So if you do have little ones around in the room, this story might be a lot. All right. So that now would be a good time to have them leave the room if that's the case. Here's my interview with family therapist Jay Barnett. When you think about mental health, what does that mean to you now versus when you first learned that this was even a thing?
Of course, early on, we think about mental health, you think about, crazy people. And growing up in the Black community, when you heard someone having mental health issues, you thought about somebody having a mental health breakdown or a nervous breakdown is what they call it. And I grew up in the South where they call depression, you had the blues. Now I see mental health just really life in motion.
Describe a time for you when you knew you needed to seek some mental health, some therapy for any mental health issues.
Gosh. So, let me take a deep breath on this one. 10 years ago, I attempted suicide the second time. And my godmother found me underneath the bed. And one of the misconceptions that people have about people who struggle with suicide and have suicidal thoughts or suicidal ideation, the clinical term is they think that they're wanting to end their life, but they're just wanting to end the pain.
What do you think is the most common misconception about mental health?
We look at people in high places and we look at people who have acquired stuff and we say they have everything. But on the back end of that, we never know what they're fighting with internally.
You talk about depression and many of the things that kind of led to you knowing that you needed to try to get some kind of help, talk to someone. How do you get a person to realize that?
For most people, it's acknowledging that they need help, and that's hard. And particularly for men and men of color, because there's this notion that you have to be strong. When men take their lives, it's usually because there's a lack of hope and they don't see their way out. But I think there's a level of abandonment that we're experiencing as Black men. How do you expect somebody to want to live if they have not been embraced? So you don't feel, well, what is the purpose of being here? Do you even want me here? Demand outweighs the solution because there's not enough Black male therapists to connect with the Black boys. I just want Black men to know that their lives are valuable and that you don't have to end your life.
Now, the goal of this series is to not just give you the problems, but also offer some solutions while we're having these conversations. There's, of course, the National Suicide and Crisis Hotline. If you aren't familiar with that, it's on your screen as well. But locally, we want to highlight Mental Health America of Greater Dallas. They've been doing work across DFW for more than 60 years. Next week, I sit down with 2 entrepreneurs addressing the idea of expectations versus reality and why it can be so hard to ask for help. In the meantime, you can watch Jay and I's conversation on WFAA.com/Black Mental Health.